Hi everyone, how are you doing? Welcome to the PhysioBRAIN channel. This is Professor Adriano, and today I'm going to give you 4 more tips to help you keep relieving pain in the elbow area, specifically for lateral epicondylitis or tennis elbow. Stay with me and don't miss these tips. And as you already know, subscribe to the channel. If you haven't subscribed yet, like the video and share it with anyone you think needs this information. So everyone, this is the 3rd video in a row. There will probably be more in the future, but this is at least the 3rd video about lateral epicondylitis, about exercises and exercise tips to relieve pain and improve this condition that causes a lot of pain in the elbow area. As we've already mentioned, lateral epicondylitis is also known as tennis elbow. And today I'm going to give you 4 slightly more advanced tips for those of you who have already done the previous 2. The first videos, those exercises, if you haven't done them, I recommend that you take a look there because they're a bit simpler. And these 4 that we're going to talk about today, that you're about to see now, are a bit more advanced. That's why it's important for you to do those first. So let's get started. Let's move on to the tips. For the first one, you can use a mug, a small weight, or anything that provides a bit of resistance, like we mentioned in the previous video as well. And then it's similar to what we did in the previous videos, but it's a little different. It involves the movement of pulling upward with your arm in this inclined position. So your hand will be in this position, like giving a thumbs up with your thumb pointing up, and you hold it like this. You can rest it on something, or you can hold it yourself. Then you keep it in this position and let it drop a little. And pull it up, let it drop a little, and pull it up again. I'll do it with this hand here so you can take a closer look. So hold here. Let it drop a little, pull it up, let it drop a little, pull it up. If the pain is acute, if you've been having a lot of pain for a few days, you'll feel some discomfort in this area, so increase gradually. You don't need to do a lot at first, but keep doing it. 5 or 6 repetitions until you can gradually increase and manage to do 10 times, 2 sets of 10, 3 sets of 10, which would be ideal. The second tip for today is also holding our mug, holding that object, that small weight you're using. It's something we've already worked on. The movement, but now it's going to be a little different because of the mug. You can also rest it on something or hold it to support it here with your other hand, and then start with your palm facing up and then turn your palm down. Palm facing up, palm facing down, palm facing up, palm facing down. Try to really focus so you can feel the movement happening at your elbow, okay? The more bent your elbow is, the better, because that way you keep it in the correct position, okay? It's not ideal to have your arm stretched out up high, but rather to keep it a bit more bent, because that way you deactivate some extensors, some tendons, some muscles that come from the shoulder. This way you work more specifically with the muscles around the elbow, right there, okay? And the third tip, keep holding the mug, stay in that position we talked about earlier. We did that previous movement, and now you're going to hold here and move it to the right and to the left, to the right and to the left. That's the movement. So you'll have your elbow like this and move it from one side to the other without letting it drop and without pulling it up. Keep it in this position. So hold it right there. I'll do it facing forward here. You turn to one side and then to the other, turn to one side and then to the other. At first it's a bit uncomfortable because your hand tends to drop and you can't move it very precisely. But as you keep practicing, it tends to get easier. You'll be able to do it better and better, and you'll feel it less and less. Pain in the elbow area. And continuing with our approach of using only technological products, like a mug, a weight, or anything you have at home, we're going to use another extremely expensive and sophisticated piece of equipment, which is a towel. It can be a bath towel, a face towel. Here I grabbed a face towel, which is a bit smaller, and now I'm going to roll it up. Make sure it's nice and neat here because it was rolled up and I messed it up. And there you go. Now it's folded up. So what are we going to do? You're going to hold it. The ideal is to have your elbows bent, not too straight. So you hold it in this position here. I hope you can see it well there. And then you're going to hold it, and with the affected elbow, the one that's hurting a bit more, you'll try to bend it forward and backward as if you were wringing out a cloth. So twist it a little forward, twist it a little backward. It's okay if your elbow moves or if your shoulder moves a little, all right? So you're going to twist forward and twist backward. So you'll do this movement. After you've done it several times, 10 times, 3 sets of 10, more than once a day, and you're improving, then you can do it with both hands, because that increases it a bit. The difficulty increases and the exercise becomes a bit more complex. So this is really interesting for you to do because I've treated several patients who had pain and they reported that when twisting a cloth or doing any movement like this, it caused a lot of pain. And this can really help to reduce the pain. All good, everyone? I hope you enjoyed the videos. I hope the exercises can really help, and I hope you can feel better. Always remember that ideally you should seek out a physical therapist or a healthcare professional to consult and see if this is exactly what's happening with you, if it really is lateral epicondylitis, and what you need to do, right? The professional will undoubtedly recommend the best exercise and the best treatment for you. Like the video. If you haven't liked it yet, subscribe to the channel. If you're not subscribed, subscribing would really help me out. And share the video with anyone you think needs to know this information. A hug, and I'll see you in the next videos.